everyone. Welcome to the Prioritize the Pause show. Now, I am so excited. I have Dr. Amanda here with us. One thing about her, I'm grateful for her because one of the first interviews I ever did once I started this whole new journey was on your show, Dr. Amanda. And I was so scared, and I might have been wearing this exact dress, and I think I was sweating the whole time. But I am just so appreciative of her giving me that first experience because that first experience really catapulted me. It just made me more comfortable with having this type of format. And heck, I was doing everybody else's show, I created my own show. So that's my little gratitude message for you, Dr. Amanda. Thank you.
Oh, wonderful. I'm so happy about that because I had the same experience with another doc that let me do that on her show. And I was like, I have to make sure I welcome everyone too. So that, like you're not as nervous because you're like, oh my gosh, what am I going to say? And then you're like, oh, that was easy. It was just a conversation.
Perfect. So, Dr. Amanda, I know you, but I want you to introduce yourself to the Prioritize the Pause community. So please take a moment to introduce yourself.
Yes, wonderful. I am Dr. Amanda Adkins, and I am double board certified in internal medicine and lifestyle medicine. Lifestyle medicine is new, so I love this. And I'm also a wellness coach and the owner and CEO of Enlightenment Health and Wealth, where we help women who are overweight prevent and reverse chronic illnesses such as high blood pressure and diabetes. And I started doing this work because myself, I was overweight as a teenager and had a lot of these illnesses in my family, and I did not want them for myself. And then others started asking me how I was doing it. So that's me.
Yes, thank you so much for that. And I realized that a lot of times we change and we help people. Well, that first, I guess, reason for change is because we're changing ourselves. Then once we've changed ourselves, then we say, okay, well, we figured out the kind of secret sauce, and people see that we figured out the secret sauce, and now they want that change too.
Yes, exactly. That's what it is. Because like growing up, I never thought that I would be out speaking to people about their nutrition and lifestyle. I did know I wanted to be a physician, but you don't know actually what that entails. You're just like, oh yeah, that seems like a good idea. What I want to do. But until you're actually in the field, because I had no one in my family in medicine, it is actually a world of difference than what I thought as a 12-year-old.
Absolutely. It hits you real quick that, oh, this is not what I thought. I
Yeah.
just for an hour and a half talking about the problems. You got 15 minutes.
If you're lucky, you got
If you're
15 minutes.
lucky, if you're on time. So I totally get that.
Yes,
So
yes.
one of your focuses in your practice and with your coaching is plant-based diets. Can you tell us? Well, let's first define it because I've heard so many different definitions. People are like, oh, plant-based diet, vegan, vegetarian, pescatarian. So, can you please define what you consider a plant-based diet?
Yes. So yeah, people ask me these questions all the time, like vegetarian, vegan, plant-based. So vegetarian, I like to start there because that's where I started myself, a vegetarian at the age of 16, meaning that you just don't eat meat. You still eat eggs and dairy, which are animal products, and highly processed food. So I tell people my favorite meal as a vegetarian was a Big Mac with no meat. Okay. So don't judge me. Then you move on to being a vegan where you don't have any animal products at all. So that includes no dairy, no fish, no eggs, cheese, honey, any of those things. And then when you go to plant-based, a lot of the times the marketing terms, they use this interchangeable with vegan and plant-based. But when we actually talk about plant-based with lifestyle medicine and actually the health benefits, it's more of a whole food plant-based. So where you actually can recognize the food in its natural form. So I tell people the easiest way to know if it's a whole food is if you can look at it without a label and know what it is, basically. So that's where the nutrients that you get from whole foods is where you actually get the most health benefit from, instead of like what I tell people, Oreos and Skittles are also vegan, but that's not the healthy foods we're talking about. Or they may say like plant-based ice cream, things like that. Like I said, this is real big at this point in time. And I tell people it's not that I don't eat those things at times, like plant-based ice cream. I just had a birthday, so definitely eat that, but that's not where you get the health benefits from. You get them from, your whole foods, your fruits, vegetables, whole grains, nuts, and seeds.
Perfect, perfect. And that was such a good definition because I know when I was practicing obesity medicine full time, I would have people say, "Well, I'm eating vegan," and then when we go or vegetarian, and then when we go through their diet, it's very highly processed, and they're like, "Well, why is my blood pressure so high? Why am I retaining water? Why am I swelling?" Well,
Yes.
yes, you're still eating a lot of packaged foods.
Right. And that's why I like to emphasize the whole food part of it, even though like when I introduce myself, I don't say I'm a whole food plant-based medicine physician. I just say plant-based, but like you said, it's the processed foods. And because of the studies with plant-based nutrition, I think a lot of the business companies and marketing firms have taken that term and used it for their own benefit. And that's why you have a lot of people that say, I eat those things and still wonder why they're not getting the health benefits.
Okay. So now we talked about, well, kind of briefly, the health benefits. Can you describe what those health benefits are?
Yes. So I always tell people the top 10 causes of death in the US, of them, 7 of them are linked to nutrition, right? So we have heart disease, you have diabetes, you have kidney disease, you have cancer, stroke, upper respiratory, like COPD, all those things could be linked to nutrition. So when we actually eat a plant food or whole food plant food diet, then we actually get the benefits of not having those illnesses. So heart disease, #1 killer in the US. So when we actually change our diet, even before we get heart disease, you can actually prevent that. And there have been some studies that show that even if you already had a heart attack or you have heart disease, that you can actually reverse some of these processes that have been going on in your body. So even as early as I believe the earliest one that I've noticed was someone that's like 10 years old, you can start getting fatty streaks built up in your arteries. So most time people think all of a sudden something happened to them, and that's not usually the case. It's usually decades of eating like we eat that causes these illnesses, but we definitely can halt them and reverse them. You can get your blood sugar better, easier by eating whole foods. Most people think that they can't eat fruit as a diabetic because they think sugar, and really it's fats and processed foods that causes diabetes more than the sugar from your fruit. It's more like sugar from a dessert or a processed grain than from eating, a strawberry or orange. So you could definitely have that. Other benefits actually working on now is looking at how it helps with your mood. So we noticed that people that eat high processed foods are more likely to have depression or anxiety compared to if you eat a whole food, a plant-based diet. You're less likely, and if it is, it's not as severe. So you get a whole gamut of health benefits. You sleep better, you lose weight, which was the big one for me, losing weight and keeping it off without having to count calories, because that was something that I kind of went down a rabbit hole trying to count calories, and again that didn't help. It just made you hungry and mad and around for everyone around you. But when you can eat a well-rounded plant-based diet, you actually lose weight, keep it off, and actually feel better overall. You have more energy, which a lot of people nowadays, they're complaining about the energy because they're doing all the excess work and things like that. But if you actually eat food, your food should energize you and not get that itis like people talk about after they eat a meal. They especially Thanksgiving, where they feel like they need to take a nap. That should not be the case. You should actually feel energized after you eat and want to actually move around. So so many more benefits probably there's that I'm not mentioning, but those are the ones that usually come to forefront of my mind when I talk about the benefits of eating a plant-based diet.
I love that. I love that explanation. And then also, I just want to piggyback on the emotional regulation part, or just improving your emotion in general. I know with my patients who have like depression, anxiety, one of the first things I talk to them about is how you're fueling your body, making sure you're putting good things in to help in that process. Of course, we're going to do medications, different things like that, but that food is very important too. And I've seen that in my own self. Many of the people who watch this know I've lost 100 pounds. And in doing that, like before, when I was heavier and eating things that just were not great, my mood was everywhere. Not that I'm on Easy Street now, but my mood was definitely up and down and up and down and up and down. But now I am definitely more level, and I can tell when the shifts are happening versus me being way at this peak and like, oh my gosh, now whole panic attack about to happen.
Yes, yes,
Yes, so it
that's
makes
so
a
true.
huge difference. So I'm curious, there are not many physicians who have the level of expertise that you have. How are you able to weave this into your practice of medicine, or are you able to?
It's definitely hard to weave it into medicine, but because it's something I love, I always try to stick it in there because most of the people that I see as an internal medicine physician have high blood pressure, diabetes, heart disease, are overweight, anxiety, trouble sleeping, all these things that we already said that how it helps. So I always tell my new patients, you're always going to get the question from me, what are you eating and how much exercise are you doing? So I guess they're getting hip to my game here. So they always say, "Oh, I'm eating vegetables," or "I don't eat this," and I'm like, "No, no, no, no. Come back to what I asked you. What did you eat for breakfast, lunch, and dinner?" So if you could tell me that, and then we talk about what's going on specifically for your own health. So I like to tailor it to them instead of just telling them in general what they can benefit from. But if someone says, "Oh, I have high blood pressure," actually, a guy yesterday, "Oh, my blood pressure is high," and I was like, "Okay, what do you eat?" And he was like, "Oh, I eat rice and vegetables." And I said, "Well, how do you prepare these things? Like a stew?" I said, "Well, what type of seasoning do you use?" "Oh, salt and pepper." You use a lot of salts in your food. You're adding that in there. Okay, great. Let's talk about that and how it's influencing your blood pressure. So that's how I could fit it into my luckily 15 to 20-minute visits in the actual in my clinic practice. But again, that's why I branched off and did the Enlightenment Health and Wealth to where I can go more into detail on what people are eating, because you really have to dig deep on some of these for some people, because sometimes it sounds like what they're doing is great, and then you're wondering, why are you still having, your blood sugar is still a little bit high? Why is your cholesterol still high? What's going on? So we need that extra time to get that information to actually help them to reverse some of these illnesses, because I tell people, you probably heard this, the ounce of prevention is more than a pound of cure. So
Yes.
once they actually have the illness, we have to do a lot more to actually reverse it than to prevent it. And a lot of people think it's the opposite, like, oh, I'll just, slowly change once I have these. No, we have to do a 180. We're turning this around immediately if we want to see the changes. Otherwise, you'll get frustrated as you just kind of tick, tick, tick to the other direction. And then you're like, well, what's the point of doing this? Because I'm not getting anywhere anyway. And so I try to plant those seeds just in go. I think I went off on a tangent, but that's
No, this is perfect because it actually segues into two questions. So I'll just do one. Tell me how a person can transition. And you kind of described that it needs to be more of a bigger shift than like a small little step. But can you talk to me about how people can transition from just a standard American diet filled with processed foods and just different types of foods to more of a plant-based diet?
Yeah, so usually I tell people the first thing you want to look at your plate, and you want to focus on shifting your plate to where it's covered with fruits and vegetables, and having like meat or processed foods as the side instead of the other way around, because our meals now are like I said, a Big Mac and French fries. So that's what it is. I'm always going to use that example because that's my favorite food. The more I talk about it, the more I won't eat it. But I have to tell this story to digress. So, like I said, the Big Mac with no meat was my favorite food. and trying to find a vegan alternative. Never was able to find that
Mhm.
until I was actually pregnant and went to a little girls outing with my sister in Vegas, and there was a vegan restaurant that had the Big Zack, and so that was the plant-based version of a Big Mac. So I said, even though I'm like eating whole foods, like full transparency, I went and had that, and
Yes.
I ate the whole thing. You hear me? So I like, people ask like, do they have to give up their favorite foods? And like sometimes it's like you just treat yourself. Again, it was still vegan if you look at it like that, but it wasn't like whole food plant based. But I was like, I was in Vegas, never seen that anyone had anything like this before, so I had to do that. Okay, so now we're going back to eating healthfully. But I just like to tell people that, because when they hear me talk, they think, oh, I eat perfectly all the time. So I just like to tell them that I'm human and there's certain things that I like, and there's going to be certain things that you like. But as you are further and further along in your own health and wellness journey, you'll learn the times that you can kind of veer off a little bit, but then you know how to get yourself back on. So it's not as um, crucial to your health at that time. So if I just had that one meal, it's not going to totally, derail my, weight loss goals or my health goals to prevent high blood pressure and diabetes. But if I was still trying to lose weight, or if I was trying to get my blood sugar or blood pressure under control, I would not tell people to do that. You can't have those treats at that time. You have to really focus and get that reversal going before you want to actually have those cheat times and enjoy. Because I mean, you still have to live in this world and life, and then you'll notice as you go along that those cravings and those things that you absolutely thought you couldn't live without, you wouldn't even crave anymore. Because also growing up, I was a daughter of a meat delivery truck driver, so we
Oh,
had
wow.
bologna, hot dogs, bacon, and sausage was always in our house. And like I said earlier, I became a vegetarian at the age of 16, and so people always ask me, "Don't you miss meat?" And I was like, "No, because I seen what meat does to people." Like I
Mm.
said, I had people dying of cancer, high blood pressure. I remember going to my grandmother's first open heart surgery when I was like, in elementary school. My mom had to take her, so I went with her because I wanted to be a doctor. So they told me, and I don't know why that sticks in my mind, but I remember her being wheeled off and her, just seeing the scar on her chest. And I'm like, I mean, I want to help people like that, but I don't want to be that patient. So when you have that deeper conviction, those cravings, they actually lessen. And so you have to find within your own self that deep conviction, so you actually can stay on your own wellness journey.
Ooh, that could be a podcast, YouTube show in itself. What is that deep conviction that's going to keep you going? What is that why under the why? What is going to keep you focused on your goal when all the other distractions happen, all the cravings come back, all the whatever comes in that you think, might be what? No, no, no. I got to remember the goal. What is my deep thing? Not the surface level, not, oh, I want to look good in this outfit. What is that deep, deep core thought and belief that is going to keep you anchored into what you want? And that is so important. And actually, this is a perfect segue to then talk about how you work with clients, because I think that's important. You mentioned about needing more time, and you definitely need more time to go through all the different complexities when it comes to diet and doing that with people. So, can you walk us through a journey that your clients will go on?
Yes. So the initial thing we do is a 20-minute consult call, just to kind of see where you are and if what I do actually aligns to what your goals are. So again, I help women that are overweight who want to lose weight and prevent high blood pressure and diabetes. So most of them have that in their family, or they've been diagnosed with high blood pressure or pre-diabetes or diabetes. And then we first go through a cleansing period. So that's when they're really introduced and like pushed into that plant-based eating, because some people are just scared because they hear that term and they think, oh my gosh, I'm so used to eating meat, what am I going to do without meat? And just in 5 days, that's the program that they start out with, they'll learn, oh my gosh, one, I survived without meat, and
Mm-hmm.
then two, I feel so much better in just that few days, and I've already lost a few pounds, right? So once I get that buy-in from them that they notice that they can actually do this, Then we start to dig into the whys. Why are you going to do this? What's going to keep you going as we could continue to adjust your eating habits, make a plan for what you're going to do for the next couple of weeks and how that's going to look. Again, it has to be tailored to you. So if we're going to be eliminating salt, are we going to be eliminating oil, are we going to be eliminating other fats, that along the way, and then continue to come back to why are we doing this, how are you feeling, what can we adjust. Because it's so tailor-made, it's hard for me to say you get X, Y, and Z, but we actually meet on a weekly or bi-weekly basis depending on what you decide in the package that we do. But a lot of people on the other side, I have one client that's lost up to 30 pounds. She's still meal planning. I tell people she's plant predominant, she's not 100% plant-based, because that's what that was her goal. So I don't knock them for that, but she still eats mostly plant-based. She craves less sugar. She does more like fruits instead of like the candies, and not doing the calorie counting that she was, that actually put her in a wrong mindset. And now she's off living life. And so I just love it. So that's what I love to do, and to help women figure out their path. It doesn't have to look like mine. It doesn't have to look like your neighbors or anything like that. It's going to be your path to keep you going for the lifetime.
I love that. And I even love the phrase plant predominant, because I think that's where I am. I would not consider myself plant based, but definitely plant predominant. I try my best to incorporate more fruits and vegetables and other plant based items into my meal, but there's definitely some meat. There's definitely some meat in there, but I definitely, even just doing the plant predominant, I've seen changes in myself, in my mood, in my health, in my everything. But I also love, oh, not but, and I also love that you take people on a journey and you tailor it to where they are and where they want to go. Everybody doesn't want to be plant-based. Some people may want to be plant predominant, but they still need those tools. And even she might start plant predominant and then do that for a couple months or years and then say, you know what? I got this. My next step is plant-based. So it really helps them to move through the steps of change in a way that's not so jarring to their system.
Right. Exactly. That's it. So like I said, I just love talking about this. So I like, once I get started, I just like keep going and going. But women, like you said, they sometimes, like I said, they just like, oh, I don't know what I want to do. But it's definitely a journey, and I'll never say it's smooth. Like you said, it's kind of like this up and down for everybody. And so once people realize that, it kind of gives them a breath, like, oh yes, okay, so I don't have to be perfect. And like you said, you don't have to be 100% plant-based. As you move from the standard American diet towards 100% plant-based, every step that you make in that direction actually does have health benefits. I like to have people push them a bit more because of the mindset. They want to see the changes before they actually commit to continuing on. So that's why we have you come in and do those regular check-ins with me, so it keeps you going and you don't kind of steer off the road, because sometimes people think after 5 days they have it, but they still don't have that deep conviction that they realize that they need to continue them on long term. Because a lot of people I grew up with, when I first became a vegetarian, they're like, you haven't ate meat since that time? Like I didn't think anything of it until I was talking to one of my long-term friends, and he was like, oh yeah, I remember taking you to McDonald's and you ordering that. You still haven't eaten meat? Like, because some people go in and out, and I'm like, yeah, no, because I, deep down, I knew that I wasn't going back, and so that's where I usually try to take people to where where you don't want to go back to, and therefore you won't go back to, because you're like, I'm not doing that anymore. That's no longer me. That's no longer me. So why would I go back?
Yes, I love it. And I know a lot of people are like, oh, I can do this on my own. No, you can't. I mean, maybe you could, maybe you can, but for long-term success, for what you want, to understand that deep conviction, to have someone who can help guide you and who understands the process. And I really do know that having a coach, having someone like you, can help so many people along their journey. Because it's great in the beginning. In the beginning, oh yeah, you're fired up, ready to go. But wait till you're at the 1 month mark. Wait till
Hmm.
Christmas come. Wait till, that thing. There's always gonna be something that shows up. A
Right.
birthday comes up. So having someone that you work with weekly or every other week can be so helpful just to make sure you're staying focused on what it is you want and can give you tools when there's a barrier that comes up that can already be talked about, identified, and worked through.
Yes, yes. And I like to tell people that I actually had coaches and a nutritionist along the way also. So it wasn't like I just read it and decided to implement it myself. No, I had that accountability to keep me going. I was in, short programs and long programs just to keep me going and to learn, because we as physicians don't get nutrition training in med school. So it was just taking my, initiative to say, oh, this person is doing that. Let me see what that's about. And to actually come to plant-based eating. Because again, remember, I told you I was a junk food vegetarian that just took the meat off. So well, I can tell people when I hear the journey, it's like I had that help along the way. And now I'm just, paying that forward with helping someone else in their journey.
Oh, Dr. Amanda, thank you so much. Can you please let my audience know how they can connect with you? Because I know there's going to be plenty of people who see this and are like, you know what? I need her help, and I need her help yesterday. So how can they connect with you and find you and continue on their journey?
Yes, so you can go to my website at www.dramandamd.com, and you can actually book your free consult right from that page. And then I'm also on social media, Instagram and Facebook at Dr. Amanda Adkins, Adkins. And then I also have a YouTube channel, Dr. Amanda Adkins.
Dr. Amanda, thank you so much for being here and giving us so much great information. We appreciate you.
Thank you so much for having me. I enjoyed talking with you.
Yes.